Hello, everyone. Welcome to our fourth teach-in for Hyp+Care. We're super excited for this one here today with you all and in the future over the recording. This is Elle speaking, co-founder of Hyp+Access. I'm going to do a little visual description of myself and then hand it over to Audrey, and then we'll dive right in. So I am a thin white person with kind of short, fluffy brown hair. I'm wearing over-the-ear headphones, tinted glasses, and some kind of long stone necklaces over a black t-shirt. And you can see an orange wall behind me, a vase with some pine flowers in it, and my cane and some tools on the other side. Audrey, you want to say hi?
Sure. Hello. I'm Audrey. I am one of the other directors of Hyp+Access, and I am a thin white person with blonde and brown hair pulled up. I'm in a room with pink and yellow lights and have some red curtains behind me. Um, and yeah, thank you so much for coming. We're very excited about this. This is one of our favorite areas, actually. So thank you, Dr. Chin, for being here. I want to talk a little bit about Hyp+Care before we get in, but this will be brief. So if you don't know about us, we're a community-based nonprofit, and we're actually transitioning into providing direct clinical and alternative care services through our medical program, Hyp+Care, that will be launching in 2026. We mostly work with folks in the connective tissue diagnosis and overlapping conditions world, and we really work with a cross-disability solidarity framework. That's our goal. Um, yeah, so thanks for being here, and I'll hand it back to you, Elle.
All right. I'm going to share my screen and take us through some slides before we start speaking with the wonderful Dr. Jen. And you'll hit this on the accessibility info of the slides. But if you need anything tech-wise or accessibility-wise, you can go ahead and message Roy in the chat, who is going to be taking care of tech for us today. Okay. Can everyone see my screen? We're good. We're going to describe what we're looking at. Again, this is our teach-in series for Hyp+Care. We're looking at a graphic with a navy background with some green hills on the left side and our logo, Hyp+Access. Some trees are growing out of that hills with their flowers or leaves made up of a pill shape, and some kind of dandelions from those pill shapes are blowing across the slide to a big ball of pill-shaped flowers that says Teach-Ins for Hyp+Care. So this is part of a 6-month series we're doing to get info out to folks. I'm going to go to the next slide. And today we are talking about cannabis for multi-system care. And this is our fourth teach-in today on the 25th of April. All right, so just some accessibility information. Again, auto captions are on. If you don't see them yet, you can click the CC button at the bottom of your screen or navigate there through the 3 dots menu. We are going to try to speak slowly, so auto captions get as much as possible. We will also read as much of the chat as we can aloud, but only messages that you send to all participants. And we will visually describe ourselves and the images we're looking at. And again, you can message Roy, who's labeled Roy Tech, for any additional live access support. And as a reminder, a properly captioned recording will be uploaded to YouTube after this live event for ongoing free access. And all the resources from this event will be posted to our corresponding event page on our website, including a transcript which we're happy to be able to start providing now. All right. So today we're going to get through our introduction and then have an interview for Dr. Chin to educate us all about the basics and kind of how cannabis works. And we'll take a little break. And then we will provide some community care tips from our own experience the last many years working with cannabis in the community, and we'll then have a Q&A time where you can ask us questions, ask Dr. Chin questions, and we can get into some of the details and mysteries of cannabis. And then we'll wrap up. All right. Audrey, could you talk about this illustration?
Sure. So this is a SEM image, which is like a really, really close-up scanned picture of tissue. And it is dense, irregular connective tissue. And so we kind of think when it's up close, it looks like weed because it's very spirally and kind of a little rough in a certain way, very plant-like. And excuse me. Yeah, and this image has threads of light yellow, plum, lime green, and navy, and they kind of twirl out of each other. And it's a really fibrous tissue. It's like parts of tendon and, you know, more fibrous layers rather than having as much fat also interwoven. And I will end there before I talk more about
So again, so happy that joining us today is our longtime collaborator, Dr. Jun Chin, who is the CMO of Leafwell, among many other things. I'm going to go on to the next slide to list some of her accomplishments, and then we'll let her introduce herself. So introducing Dr. Jun Chin, for those of you who don't know her, on the left, we've got an image of Dr. Chin, an Asian person with brown hair wearing glasses against a light green to light purple gradient background. And Dr. Chin is the Chief Medical Officer at Leafwell, leading educational initiatives, regulatory compliance, and healthcare engagements across 38 states. The Vice Chair of the New York State Office of Cannabis Management, or OCM, the Cannabis Advisory Board there, as well as the Chair of the Health, Safety, and Research Subcommittee at OCM. She is also an adjunct professor at Syracuse University and NYU, designing courses on cannabinoid pharmacology, harm reduction, and cannabis safety, and a board member of the Association of Cannabis Health Equity and Medicine, or HM. And I'm not sure I'm pronouncing all those acronyms right, Dr. Chin, but we did our best. All right. And now, we just want to give a little background of what Dr. Chin and us have worked on throughout the years. 8+ years of supporting Hyps, or people with connective tissue conditions and overlapping experiences here in New York State. So one of the big things we've done is direct care, education, and advocacy. This was through Hyp+Access's care coordination and advocacy program, which is currently on pause and being transformed into Hyp+Care's services. So we were referring patients and supporting them on their cannabis journeys, Dr. Chin with her medical expertise, and us with our community knowledge and care navigation services. We also use this time to create Hyp-specific cannabis knowledge that's centered on connective tissue mechanism and how people with connective tissues need care, whether that's understanding the product landscape and advocating for products that people need, sharing and developing Hyp-specific symptom management practices, and exploring the unique effects of cannabis on Hyp bodies. And we're really excited to talk about this one more later with Dr. Chin. We've also worked together or contributed to legalization. Dr. Chin's tirelessly been working for this across many states, and Hyp+Access's referrals provided essential de-identified Medicaid patient usage data, which helped expand the medical cannabis program here in New York State and ultimately support legalization. So this data showed impact and the benefit of the medical program to policymakers, which paved the way for improved access and treatment options for patients, as including the possibility of Medicaid coverage, which is really amazing. Yeah. All right. So now we're going to start asking Dr. Chin some questions. And Audrey, if you could head over to that doc and get us started there, that'd be great. I believe at first we're just going to ask Dr. Chin to introduce her and her work.
Thank you so much. I wanted to take a moment to sincerely thank Hyp+Care and Hyp+Access for supporting the community and for hosting today's gathering. It's truly, truly an honor to be here. I'm grateful for the opportunity to share this time with all of you because spaces like this where we can all come together and connect and learn from each other are so important. And it's because of organizations like this who genuinely care about building stronger, healthier communities that gatherings like this are possible. So thank you again for your hospitality, for the important work that you all do every day. I'm so grateful to be part of today's event and to be here with all of you. So I started as a cannabis patient before I even became a physician. When I was a teenager, I was diagnosed with ankylosing spondylitis, which is basically an autoimmune disease of the spine. Normally, you are disabled by the time you're 20 years old because the vertebrae in your spine start to fuse together. So it's the opposite of hypermobility. You actually lose all mobility. Can't really bend and touch your toes, side bend. Even when you're driving, let's say you're driving and you're trying to look at the blind spot and you're turning around, you can't do that because the vertebrae or the bones in your spine just literally crazy glue together. So by the time I got to med school in San Francisco, I was having a hard time standing. I was having a hard time with pain management. I would wear this back brace and it would cut into my ribs and I would just, bleed through my scrubs. But I needed that back brace to give me stability and to take me out of pain. And one day, an attending, one of my mentors, Dr. Levine, he was an HIV and AIDS physician in San Francisco. He asked me why I was having so much pain, what was going on. When I told him what I had, he said, "Oh, well, you're not going to finish medical school. You can just forget about being a doctor because you're not going to be able to work longer hours. You're not going to be able to stand in the OR, deliver babies. It's just impossible. You're going to be in too much pain." And I was disheartened because here I was training to be a physician, but no one could really help me. I've been, through the turnstile of providers and alternative providers. I've told my story a billion times and no one, here I am training to be a provider, but no one could help me. He gave me a suggestion. He said, "I think that marijuana will help you because it helps my HIV and AIDS patients." Now, this was in the late 90s, and there was no CBD oil or anything fancy. It was just, here's some weed. I steeped it with some alcohol. It's in a bottle. Try taking some or try smoking some. Reluctantly, I did. And I say reluctantly because I grew up in a very traditional Chinese household, and my mom taught me that cannabis caused schizophrenia, and I believed it. But when I tried it, it changed the trajectory of my life. I was in a lot less pain that I could do the dishes. I was in a lot less pain that I can actually sit and open my textbook and read for 20 minutes at a time. And so I dedicated the rest of my career into figuring out what was so special about this plant medicine and why isn't more patients helped by it or know about it, and why don't more providers know about it. So decades later, here I am in New York. I grew up in the Bronx. I came back to New York after my training. New York legalized cannabis in 2016. I sit on the OCM advisory board. So what that means is I advise the regulators in New York how to increase access, how to increase research, and how to increase safety for patients.
That is so amazing. Thank you, Dr. Chen, so much. And maybe we can move from there into our first question. And I still need your help, Audrey, while I'm on the slides. We'll talk about the endocannabinoid system soon, right?
Yes. And thank you, Dr. Chin, for sharing. I actually didn't know all of those things about you. So
No.
thank you for your story, and it's very cool. So to get into it, for those just learning about cannabis as a care option, can you tell us what it is and how it works?
What is cannabis? So cannabis is a plant that has been used for thousands of years for healing, for rituals, for community. But scientifically, what makes it special are cannabinoids. And these are chemical compounds that interact with our body's natural systems to bring balance and relief. Cannabinoids, there's two most well-known cannabinoids, which are the molecules of the cannabis plant, THC and CBD. The plant actually has over 100 cannabinoids, plus terpenes, which are the smell molecules. That's what gives the cannabis plant that pungent, earthy odor, and flavonoids. But all these things work together in what's called the entourage effect. Now, THC is known for its psychoactive effects, that high, but it also helps with pain, with nausea, appetite. And there's CBD, non-intoxicating, but it has powerful anti-inflammatory and calming properties. So how does cannabis interact with the body? And this is where it gets really fascinating. We all have an internal system in our body called the endocannabinoid system, or ECS for short. It's like the body's command center. And think of it as that command center that maintains balance. So it helps you regulate pain, mood, sleep, immune function, digestion, and more. So you don't have to believe in cannabis for it to work because you're born with the system it interacts with. It's already inside of you. So if you look here at this PET scan, everything you see here lit up represents the galaxy of cannabinoid receptors in your body. I mean, they blanket all of the organs here. You can see the liver, the spine, the digestive system. I mean, everything here is lit up. These endocannabinoid receptors are found throughout the whole body, your brain, your immune system, your skin. So when there is an imbalance in this system, you'll have symptoms that flare. And cannabis, the plant, can help supplement or regulate the system, just like insulin does for someone with diabetes, for example. So what can cannabis help with? Do I keep going?
Sure, yeah.
Okay.
I'm happy to ask questions, but if you just want to go for it. That's
Okay.
great. Thank you.
So cannabis can help with a lot, but here's the nuance. Not every product works for every person, and the right solution is different depending on your biology, your lifestyle, and your condition.
Amazing. I'm going to stop the share there so we can see each other's faces better as we get into more questions. Yeah. So symptom management applications. Yeah, Audrey, do you want to talk a bit about the symptom sets that we think about and how all those diagnoses overlap?
Yes. Are you talking about the second bullet point here? Sorry.
I am indeed, yes.
So we kind of think of all of these different diagnostic groups as really interrelated. They're not separate in our minds. And we think more about it from the mechanism of connective tissue variants, and kind of care a little bit less about the actual diagnosis more than access to care. So that's kind of an approach we take. So whether it's a connective tissue disorder, dysautonomia, or dysfunction of the autonomic nervous system, uh, allergy and immunological changes, musculoskeletal, chronic pain, chronic fatigue, myalgic encephalomyelitis, long COVID falls in this category for us, and many more. We've got that chronic pain, chronic fatigue, autonomic dysfunction, and then kind of maladaptive allergic and immunologic responses to things. Things are more permeable. They don't quite function as separately maybe as they could. And then under those diagnostic category umbrellas, we think of so many other diagnoses as involved as well, or the way we explain it to the DOH is secondary, even though it may not be for the person in their experience. So diagnoses are very much an imperfect system.
They
But,
are. And
oh, sorry, can I say one last thing?
please do.
We think about cannabis in relation to all of them. So we want to talk about that today too, and applications in relation to all of these different components. Should
Totally.
we go to the next question?
Yeah, I was just going to add, interestingly, that to us, ankylosing spondylitis would be part of that, where you've got connective tissues being impacted in the body, and that leads us to how impactful cannabis can be for the whole body and for looking at these things for the ways they're connected, not the ways that they are separated by medicine. So that's kind of the basis of our work, is understanding that all these body systems and all these structures are inherently connected. Connective tissue connects the issues. So Dr. Chin, could you speak to that inherent interconnectedness of the body's systems and why cannabis can be so powerful for the whole body?
Sure. Patients with overlapping diagnosis like POTS, hypermobility, hyperligamentous laxity, fibromyalgia, even long COVID, for example, mast cell activation syndrome. These are cases that we treat on a daily basis. If you think about the systems, the symptoms across all these systems: chronic pain, brain fog, GI distress, sleep disruption, anxiety, autonomic dysregulation. Cannabis doesn't treat a single symptom. It helps rebalance the entire ecosystem because it's such a potent anti-inflammatory, and inflammation is usually the root cause and the overlapping symptom across these different disease states. I have a quick story. I had a patient a couple of weeks ago. She came in with long COVID and postural orthostatic tachycardia. So she said, my heart feels like it's going to come out of my chest. I feel like coming out of my skin. She couldn't stand without her heart racing. Her sleep was impossible. She had POTS, but because she had COVID, she had a flare up. And she had long COVID, so she couldn't get this flare up under control. And so her sympathetic nervous system, her fight or flight part of her body was just out of control. So she couldn't sleep or digest food. We started her on some cannabis just at night. And then within weeks, she was sleeping, just sleeping. She still had the other symptoms, but because her sleeping started regulating, her mood improved. Then she was able to go back to physical therapy. And then her flare up improved. So cannabis didn't cure her, but it interrupted that vicious cycle of sleep disruption long enough for her body to start healing.
Amazing. Cool. And Audrey, were you going to say something? Sorry, I heard someone's voice.
I
No.
was just going to say, when you talk about connective tissue connecting the issues,
Yeah.
that's why everybody's systems is talking to each other's system. When I think about my training as a health provider. You come in and you see me, and let's say you're complaining of sleep disruption and stomach pain. They're completely unrelated. You're going to go to the GI doctor for your stomach pain, and then I'm just going to give you something to knock you out at night. Forget about thinking how one might be related to the other, but it's closely related. The whole body functions as one unit.
Exactly.
And receptors. So many receptors. Yeah. Which is what I geek out on for sure. Elle, do you want to take the next one?
Sure thing. So to get a little more practical and a little less science, a lot of people who may be coming to this for the first time may not be aware of all the different ways that cannabis can be used. Dr. Chin, if you could kind of outline the different ways. A lot of people think it's just smoking, but that's really definitely not the case.
Most people do think of smoking, using a joint or a bowl or a bong. They might think of gummies too, edibles or chocolates, but there's so many options. There are tincture oils, so it looks like a liquid tincture where you have a dropper bottle and you can put the tincture oil directly onto food or directly under your tongue. There are capsules, like gel capsules, tablets that you can cut it in half. There are patches, so you could put on your skin if you just want localized joint relief or ligamentous relief. Topicals. There are cannabis inhalers. So if you think about if you have asthma, that albuterol inhaler that you can pump directly into your mouth and your lungs, there are cannabis inhalers as well. There are suppositories, cannabis suppositories. Those are really great for patients that have localized pelvic pain or maybe pain in the anal area, or if they have fissures or Crohn's disease, any irritable bowel disease, the suppositories work really well. There are daytime formulas, which means cannabis formulas that don't make you high, don't make you sedated, don't make you feel altered, that you can function and be able to operate machinery, be able to drive. There are sleep formulas that can help you sleep, that can balance your circadian rhythm. And there are a bunch of cannabinoid, minor cannabinoids. So those are different cannabinoids that besides CBD and THC that don't have any psychoactive effects at all. And those are known as like CBN, for example, or CBG. Yeah, I think that's what I have.
Amazing. Someone asked in the chat that they have heard of people using topicals and applying it within the belly button for quicker absorption. Any thoughts on that, Dr. Chin?
You can use it anywhere you have pain. If you have cramping, I do have patients that will say they like to apply it near the umbilical cord, near the belly button, but some patients will use it directly on joints that are out of place or swollen or flared up. Sometimes patients will use it in scar tissue areas, where there's adhesions. One of my patients who suffer from endometriosis, she has pelvic adhesions. She will give the cannabis topical to her physical therapist, and her PT will actually work with the topical deep into the pelvic area and break up those adhesions. And she finds much more relief with those topicals in that area.
Amazing. And we'll get into topicals a little bit more later as well. It's one of our favorite use methods. And then Dr. Chin, what about things that might interact negative? Oh, sorry, Audrey. Interjection.
Interjection. I have a follow-up question. So Dr. Chin, is there a place in the body or on the body that is quicker absorption versus not is there, I don't know, are there differences in skin areas or like under the tongue, I don't know, mucous membranes?
The fastest absorption, meaning let's say you want something that's oral, would be a smokable form because it just goes perfuses into your lung, or a sublingual tincture that you put under your tongue because it gets absorbed into your gum and your mucous membrane. I would say topicals, it really depends on how good the topical is, the ointment. There should be penetration enhancers, which means it deepens into the epidermal layer, can, absorb a little deeper. But it, of course, depends on the topical itself. Edibles would be the slowest acting because it has to get through your metabolism and through your GI system and through your liver. So I always recommend a low dose edible, especially if you've not tried edibles before, because it takes a while for it to kick in. So many mistakes that patients will make is they'll take a gummy and, in 10 minutes say it doesn't work, take another gummy, and then an hour later they are a little uncomfortable.
Yep, been there.
I think we all have.
What about other maybe negative experiences? What about medications and treatments that might interact negatively with cannabis? Is there anything people should be aware of there?
Just like any herbal supplement, your medication can act with, nutraceuticals, your prescription medication. So it can interact with cannabis. Things to watch out for if you're in blood thinners or sedatives or other medications that are metabolized through the liver. So you want to make sure that you're with a cannabis informed provider, but also if you're comfortable using cannabis and you have prescription medications, try to take it 3 hours apart. Use your prescription medications first or use the cannabis first, and then you wait 3 hours and then you can take the prescription medication.
Great. And how about people who are thinking about approaching their care providers? Do you have any advice for how to start talking to cannabis about them or seek out providers that might be more supportive?
I find that it depends. Providers have their own cultural biases as well. I certainly had, when I was a student, I did believe my mom. I believed my mom because she said, cannabis caused schizophrenia. So it's something in the back of my mind said, I knew it didn't cause schizophrenia, but something in the back of my mind thought, you know what, cannabis is just bad news. So you might meet a provider that has cultural biases and you have to just accept that. But I think if you come asking with studies, you might want to contact an integrative cannabis provider, our Leafwell network. We have over 100 providers in 30 different specialties. And oftentimes cannabis providers will, I know our providers will be willing to work with your own provider so that you have a teamwork, a team of that will care for you. Because most providers will say, I don't know anything about it. But if you say, I actually know a provider that can help guide me through it, would you be willing to work with them? Most of, doctors will say yes, or most health providers will say yes.
Totally. All right.
We have a comment in the chat. Or were you about to get to that, Elle?
Oh, no, I wasn't. I missed it.
Someone says, I see that a lot down here. Many psychiatrists in Southern Illinois refuse care for people with medical cannabis. That is a bummer. And it is definitely real how those biases are still so entrenched. Like it's just, yeah. Is Leafwell in Illinois?
We are.
Okay. Well, actually, I don't know if that helps because of the psychiatry, but maybe there's a way to connect with a psychiatrist that works with Leafwell patients, right? You have networks of providers.
Yes. Or we can help you find a local provider.
Great, thank you. And someone says, I have to go, but can't wait to watch the recording of this. Yes, for sure. Do what you need to do. Okay. Sorry, Elle, go ahead.
No, no, it's fine. Our last question here is about increasing cannabis access and the work that you've been chipping away at, Dr. Chin. You and Leafwell have been doing amazing work to make cannabis more accessible and affordable, and I'm sure many other organizations that you work with. Could you tell us about your progress toward getting patients insurance coverage for cannabis?
So we started working with employers. The city of Trenton, Newark, Orange, and Teaneck. These are civil workers. So think Board of Education teachers, administrators, people that work for the city. New Jersey is very progressive and decided to allow their employees to get integrative cannabis care. So what that means is you're able to see someone on the Leafwell platform on our provider network and get a medical cannabis card to get certified. If you don't need a medical cannabis card because you live in a state that has both adult use and medical use legally, so you don't need a medical card, you're still able to see a Leafwell provider and you can get guidance. And this gets covered by those employers in New Jersey. We are expanding throughout the United States. And we started with employers first because that allowed us to bring in as many patients as possible. So that, for example, New Jersey brings us over 10,000 patients. And we wanted to start measuring and to start following the data. And we work with Aetna, Blue Cross Blue Shield. And the questions they ask is, what happens to ER visits with medical cannabis patients? What happens to medication usage? Are they able to cut back on medication usage? And we have found that integrating cannabis care cuts ER visits in half. So patients are going to the ER less, patients are seeing their primary care less, and they've actually stopped using benzodiazepines, sleep aids, and opiates. So we're taking that data to give it to the third-party payers, to the insurance companies, so that we can fight for expanded coverage and hopefully Medicare and Medicaid and beyond other payers as well.
Brilliant.
Yeah, that's
Thank you
huge.
so much for all your work. Yes,
Yeah.
amazing. Any other quick questions from the audience before we take our break? And we'll also have our Q&A at the end for anything juicy. All right. I think we're probably good to go. I'm going to pause the recording, and then we will take 5 minutes and come back and start sharing some community care tips. All right. All right, we are coming back from our break, and we're going to get into going to the next slide. Community care tips from our 8+ years of patient care coordination and advocacy. And just to be clear, this is not medical advice. This is gathered knowledge from being in community and working in community. All right. So starting us off, we just want to share some observations from our work. And, research may be needed to validate these things, see how they work for a lot of people. We're talking about trends that we've witnessed working in connective tissue communities. So definitely THC, one of those major cannabinoids, tends to be more impactful for pain. And also we notice muscle tension and spasticity, and when applied topically, stimulating blood flow, which can be really useful. And as Dr. Chin was talking about, CBD tends to be more impactful for inflammation. And we also noticed mast cell regulation. So for folks with mast cell issues, inflammation, MCAS, CBD can be a really powerful part of cannabis as medicine. We also noticed that many hypes, or people with connective tissue variants, do better with indica dominant strains. And strains are just cannabis plant breeds. And indica is one type that's usually thought of as being more subduing. But we notice that lots of connective tissue folks seem to do better with indica strains, even when they're not trying to get sleepy versus sativa strains. But everybody is different, and this is not a hard and fast rule. It can be different for many different folks, but we tend to see indica working best for the majority. And then some reasons that cannabis doesn't work for some people. It really isn't the best choice for everyone, but it is a really impactful medicine that more people need access to. So some of these reasons can include allergies to cannabis itself, which is rare, but really real. There's also cannabinoid hyperemesis syndrome, or CHS, which can rarely happen with long-term use and cause hyperemesis, means lots of vomiting. It can cause really impairing reactions to cannabis. And then people can also have sensitivities or atypical reactions to particular cannabinoids that may not be kind of what the mainstream thinks. An example would be CBN, which folks normally think makes people sleepy. Sometimes that makes people really wired, we notice in connective tissue communities. And then, of course, if you have lung issues and you're trying to use inhalation, that can be really challenging. Even vaporization can be challenging with lung issues. And then for intestinal issues, including poor absorption and mast cell reactions, things like capsules or edibles can be, challenging to use as a care method. But depending on the individual, some less common cannabinoid combos and different ways of using cannabis may still be worth trying. Some examples would be a very low THC product and including other types of cannabinoids like CBN that I mentioned and CBG. There's so many cannabinoids. You can keep learning forever. Another example would be just using topicals, using things like transdermal patches, sublingual products, and suppositories instead of inhalation or ingestion. Go to the next slide. Audrey, you want to take this one?
Sure. So THC can significantly drop blood pressure, whether inhaled or ingested. An edible would be later on, much later after you took it, like Dr. Chin was talking about. So sometimes that's really when it sneaks up on you and you're in the middle of something where you wish you weren't, experiencing the drop in blood pressure. So this can impact people with that autonomic dysfunction or dysautonomia, POTS, we've talked about as a common diagnosis, and other related symptoms like chronic low-grade hypoxia, which is reduced oxygenation of tissues. So, if your blood pressure drops and you're already kind of pool and you've got stretchy veins and you're standing up a lot, it can make the pre-syncope happen, basically. And some people feel that as anxiety or feel like, close to kind of panic attack. And THC, when used topically, can relax and release tissues, which is why we were talking about how it can be really helpful for spasticity and muscle cramps and things like that. But obviously for people with connective tissue stuff at all, this can increase risk of injury depending on where you put it, and depending on what you're doing after you put it on. The combination, it's kind of always a combination of like how and where and then what you're doing while you're experiencing the impacts. So we often, and this is dependent on the person too, and some people, the pain relief in the feet and legs is really important. But sometimes using on your feet and your legs or specific joints when you're going to be more active, like lifting or you're going up and down a lot of stairs, sometimes it can just make that instability increase a little bit, and then you're more at risk to sublux something. Avoiding use with caution on your spine or other unstable joints when you're sleeping, because sleeping also we have to watch out for. Unfortunately, it's kind of like whatever activity you do, actually, there's a caveat, you know. So we like to recommend folks to use topicals that have multiple cannabinoids, have that balance, that like, what did you call it? The effect, Dr. Chin? Is such a good word of the multiple cannabinoids.
Entourage effect.
Entourage effect. Having the entourage effect is also, from our perspective, important in topicals and can really help a lot of things simultaneously in a more balanced way, whereas using just a high concentrate THC can, that's one part of the balance direction.
Yeah, we'll get there. And I'm also going to add, missed the tip at the top, Audrey, for the drop in blood pressure. We noticed that timing caffeine intake or use of other medications that increase blood pressure, like midodrine, which a lot of POTS folks are on, this can kind of help offset the blood pressure effects of THC and be useful for maybe being more active. And we'll repeat that tip for something related on a following slide, as well as talk more about topicals. All right. So some more must-knows and tips. THC can sometimes increase anxiety for folks or other feelings of distress. And the strain or the breed of cannabis plant can impact this, as well as the balance of cannabinoids within it. And we'll talk about this later, because you can find products out there that are really made from the whole plant and then have that whole entourage effect. And then there are products that do not. So a tip with using THC that is also previously mentioned by Dr. Chin with edibles is starting low and slow. So with whatever form of cannabis and new cannabis types, making sure you're starting with something that might not even quite be meeting what you need for your symptoms and building up from there to avoid some unfortunate outcomes. You can also try combining THC intake with regular use of CBD. We're going to talk more about CBD on the next slide, as well as compounds like CBG, a cannabinoid which many find helpful for anxiety and pain. And if THC doesn't work for you, maybe you want to try a CBD CBG product, hopefully one that is made from whole plant. And then again, timing caffeine intake or other medications or substances that help with blood pressure can be useful here, because the blood pressure effects itself, when that drops, can interplay with anxiety. Yeah. Anything you want to add there, Audrey?
I don't think so.
Great. Right, next slide. So CBD. We have found CBD's anti-inflammatory and system regulating properties can augment THC's positive effects and offset some of its side effects. So I feel like this is a specific manifestation of that entourage effect. We also know from research that CBD may have unique properties for immune system support, and we have a citation there that we'll share out in our resources. And we're going to talk later about CBD and cannabis for viral exposure as well. So a really important note with this, because a lot of folks, when they try CBD, they're like, I don't feel it, it's not doing anything. And that may be about the product or how you're using it or what you're using it with. But part of it is also that its effects are usually not felt immediately like those of THC. But regular use of CBD and whole plant cannabis can establish a supportive baseline for a lot of different symptom sets, kind of like taking vitamins or other supplements, as well as provide support for acute symptoms like mast cell reactions. Yeah. Might go into the next one. Want to take this one, Audrey?
Sure. So there's a lot of talk in the industry about full spectrum versus isolate, and in patient communities as well. So full spectrum products contain all of the naturally occurring cannabinoids from the plant, the full entourage effect, including trace amounts of THC. And usually it's not enough to have a psychoactive effect. And it can be very, very impactful for everything, including brain inflammation and healing, and generally maintaining that body-wide baseline and hopefully improving that baseline. So I like to talk about polypharmacology, which is basically just like you're using the full plant rather than isolates. The majority, if not all of our, pharmaceuticals are singular isolate chemical compounds, and they even often choose like which way it's rotating. So they're like really not having the entourage. Um, so all of the chemicals in a full spectrum product are working together rather than in isolation. And from what we observe, and I'm sure Dr. Chin, you have things to say about this too, recreational trends and kind of reactionary legislation have increased popularity of cannabinoid isolates, and it also really ends up favoring much larger conglomerate companies, and pushes out a lot of the smaller businesses and people who are making really incredible formulas and able to sustain a small business. And I don't know, entourage effect. I just love that term. Yeah, THC products get people as, quote unquote, high as possible, um, and made from multiple homogenized strains or isolated THC, but then we kind of lose the natural cannabinoid profiles and the consumer ability to choose ideal strains. It kind of becomes like the isolate is the strain, or the way they end up marketing it is, I don't know, it almost becomes like an intellectual property war or, disagreement. So I don't know. We're not about the isolates, but we understand why it's good to have them as options. It's just the way that the dialogue and the negotiation, quote unquote, is going is at least in California, what I've been seeing. I'm like, ooh.
Yeah, California and here in New York, as recreational has happened, you see this trend manifesting as even medical dispensaries starting to sell products that are not made from specific strains that are called something like brighten your day and just
Yeah.
have really high THC quantity and maybe no CBD quantity. And that is not what we like to see in terms of patient care options. Yeah.
Um, and I will add that, at least in New York State, the medical program, medical patients get access to, from our perspective, much better quality products, much more consistent products, um, a variety that, well, CBD could come back a little bit more. I think we have a little bit of feedback. But compared to, going into a dispensary, it is more consistent and just easier to find kind of the products you like, and it's cheaper because of tax differences on the medical consumer versus the legal consumer. And so for the cost of a medical card, you're going to make that back and some in purchasing cannabis products here. So it's really, and you can get it delivered to your door, I mean, it's really, that's a really great part about it. Okay, I'll pause.
Great.
Yeah.
Right. Next slide. So now we have a pretty long slide where we want to share some information about cannabis as care for COVID and other viral exposure. So CBD and cannabis in general may be significantly helpful. We believe they're very significantly helpful, but research has shown they may be significantly helpful in both fighting COVID infections and recovering from them. We have a citation there that will also be in our resource share out. So we want to share some of the practices that we've developed during the last years of pandemic. And one of those we call CBD loading. And this is using high amounts of CBD when an exposure to a virus is suspected or confirmed. And this can also be combined with use of antihistamines for greater mast cell regulation power. So if you're someone with mast cell, someone who thinks you might have mast cell, you're exposed to a virus, taking that CBD, taking an antihistamine that works for you can be a really great combined practice. And we want to note here that this same method of CBD and antihistamines can be applied to vaccine prep and recovery for people with connective tissue issues who have stronger reactions to COVID and other vaccines. And you don't want to take too much antihistamine and kind of offset the power of that vaccine in immunity. But taking some antihistamines and lots of CBD, we found can really help people manage that. And then because COVID is a respiratory and vascular virus, a mast cell virus, inhalation can get really tricky if that's one of your main methods of cannabis consumption. So some alternate options to inhalation include ingestibles, which come with their own issues if you have lots of GI issues, sublingual products, suppositories, and topicals is the one we really want to talk about. So we found that ointments rich in CBD on areas concentrated with lymph nodes, like under the neck, under the jaw, the armpits, the front of the pelvis, where the low belly meets the legs, can be helpful when dealing with viral exposure. And again, this isn't necessarily proven by science, but it does align with a lot of science and anatomy. And we found that ointments that are rich in THC, especially on areas with thinner skin near major vessels, seem to be able to improve blood flow, including to and from the brain when dealing with neuroinflammation. So inflammation of the brain that may come with the virus or with long COVID or with any other type of long haul virus disability. And this is probably because it helps improve the blood flow through the microvasculature. So those tiny little veins that end up getting really impacted by viruses like COVID, we find that these applications of topicals can help with the blood flow through there. And CBD or a balanced one-to-one THC topical we've found can be useful for mucous membrane support or to help not lose smell or taste when dealing with the COVID or other infection. And this can be, it sounds kind of ridiculous, things like applying it in and around the nostrils, the sinuses on the face, the back of the throat, inside of the mouth on the gums, all around the neck and the lower face, even in or around the ears if they're feeling kind of itchy or weird, because all of that anatomy is connected. And we want to make a really important note here that not all topicals would be safe for this kind of use. You've got to make sure that it's a type of topical that is safe for internal use, doesn't have lots of added ingredients or things like menthol. Yeah.
The topicals that are with fats in them, like if it was a very simple coconut oil or something, that is a good way to try. Like a lotion wouldn't work. But yeah.
Yeah, we have that here on this topical slide, more information about it. Coconut oil is an example, though. We were a little too scientific here. So we really love topicals. We talk about them a lot. They're a great option for targeted symptom relief. And we find that those topicals with what are called medium chain triglycerides or MCT oils work best for absorption. So that is something like coconut oil and various other body safe oils. Let's see. And ratios, again, high CBD seems to be good for sensitive areas and areas of inflammation and injury. And high THC can be helpful for nerve pain and really high pain, as well as that blood flow. And balanced one-to-one ratio products are a really good place to start as you find out what cannabinoid concentrations might work best for you. Or if you're just like, I can't make a decision, a one-to-one is great because it gets you a really full spectrum, if you will, powerful impact with your topical product. And I'm out of breath a little. Audrey, could you talk about our tips for topicals?
So for people who I mean, we're thinking about upper rib and like shoulder instability and just how impactful that can be upper spine instability. We tend to recommend people start with tissues on the lower half of their body, but also feet and lower legs can be a problem. So maybe it's more like lower mid. I don't know how you want to envision. And then once you know how your tissues are tolerating it, you can work your way up and see how that shifts, because a lot of times increasing the blood flow is coming from vasculature opening up. And if it opens up, too quickly, that can make somebody lightheaded because of all the things we talked about before with gravity and things like that. So we're kind of trying to figure out where the line is, and it's different for everyone for sure. So topicals are a similar based on placement and amount and what's in them. Different people really figure out different things that work best for them. And when we think about applying topicals, we don't think about just going to the pain site, because usually the pain site is, especially with musculoskeletal stuff, directly on organs is great, actually. Direct on organs, awesome. But in terms of joints, we like to think about the application more three-dimensionally around the pain site and maybe what's opposing the pain site, because the pain site is kind of the outcome of the 3D structural dysfunction. And because the topicals and the cannabinoids in them are so impactful to tissues, it's really great to have kind of a more balanced amount of relief in relation to the dysfunction and not just at the pain site. And then maybe other things can shift a little bit more that makes the impact sustain longer, because of course one of the things is the patterns that we all have that we're kind of constantly navigating. So yeah, an example of that would be like armpits and also your chest tissue and maybe even your diaphragm for your shoulder, just so that kind of some of this musculature that's really stabilizing in different directions can help support the shoulder in relation to what's maybe releasing there. And applying to fattier areas really do absorb a little bit better into the tissues or differently. I mean, it's just that's really the the endocrine system and where a lot of these receptors are too. And so three-dimensionally, even if it's muscle pain, don't forget the fat that's around there, because that's going to help balance the rest of the systems around that area that are probably also impacted, because mechanical things impact the structural, impact organ systems and things like that. So it's all connected. Okay, that's my end of that one.
We'll try to get through this next section a little quickly so we can get to the Q&A. Just a little more about topicals, our favorite thing. We want to caution that when using products with anything beyond trace THC content, just make sure your pets and children can't access that, like with any cannabis product, and are prevented from licking the topical off your body. Because if it is one of those oily topicals, they may be really into that idea. And we have a link here. Roy, if you're able to find it and drop it in the chat, that'd be great, but I can also do it after I demonstrate topicals. We have a full list of some suggestions for areas of application based on symptoms for using topicals on the body on our website. And now we're going to just quickly demonstrate one classic application technique that we've developed for neuroinflammation, including headaches and improving blood flow to and from the brain, things like neck pain and more. And it's just applying topicals along the sides of the neck, surrounding the veins there. So I'm going to pause my share and demonstrate that real quick. All right. So
should we pin you, or how do we make you big on the screen?
Sure. Let's try pinning me. Let's see. Hopefully that will work for the recording. So I'm going to quickly show something that we've used over the years and seems to be pretty helpful for lots of folks. I am using a 1-to-1 topical that's very, very oily, and you might not want to get on a kind of fancier clothes. So I'm going to, oh, childproof. I'm going to open this jar and just dip in. For me, I'm going to use my middle fingers, and I have just a little bit of topical on either side. And I'm going to first dab that onto the area that I'm targeting, which is the side of my neck, kind of these sternocleidomastoid mastoid muscles that reach up from these collarbones to the sides of the skull. I'm going to then kind of rub it in, and I find that rubbing upwards works better for me than rubbing downwards, just because of my upper spine instability. And if I weren't wearing headphones, I would probably rub it up into the area behind my ears. And then I always do both sides, even if I'm having a headache more on one side. I'm dabbing it in first because I find that's easier for me, and then usually rubbing it upwards. And this can be a nice thing to do when you have a headache, when you've been exposed to COVID and are dealing with lots of neuroinflammation, when maybe you're having visual issues. These both muscular structures and vascular structures that reach up into the skull are incredibly impactful for lots of our functions, as well as clustered with many of the nerves that go through from the brain into the shoulder and the rest of the body. I'm going to rub that in there. And I find 1-to-1 is a really great choice for this because you're getting that pain and muscle effect as well as the anti-inflammatory effect. And if I have extra, I might rub it under the chin where lots of lymph nodes are, or over the throat. All right. Done with that. And now my hands are really messy. And if I did have a dog, I wouldn't let them lick this one because it does have pretty significant THC content. All right. Then we have a fuller list of a lot of different ways you can use topicals on our site. Different things work for different folks. So it's fun to play around and figure out what might work best for you. All right. And now we are going to get into our Q&A. Time for folks in the audience to ask any questions that may have come up while you're listening to Dr. Chin, while you're listening to us. And we also have collected some asynchronous questions from community. We had over 80 people sign up for this teach-in, but a lot of folks have complicated schedules and symptoms and weren't able to attend live. So I want to make sure we answer some of their questions too. All right, I'm going to unpin myself. And now we'll open the floor. And Roy, maybe you want to start us off with one of our questions from community.
Yeah, for sure. Hi, everyone. I'm Roy. Let me pull up these questions. Let me see. Oh, one that we got that I think we might not have covered yet is, what if cannabis isn't legal in my state and medical is hard or impossible to get? Can I still access any cannabis care?
It depends on, so it depends on the state. If there's no cannabis available, no medical, no adult use, many patients will use hemp-derived cannabinoids.
And sometimes there are online businesses that ship places, different places. So there might be some searching. Yeah. And Dr. Chin, how many states are still that way now?
38 states are medical and adult use,
Okay,
medical and or adult use.
so that would be 12 that are not either, right? Because medical comes before
Mhm.
adult use.
But most CBD and hemp-derived products are legal throughout,
Correct.
right? Yeah. We have a question in the chat about topicals. Are there certain brands you recommend for topicals? Dr. Chin, I know you were talking about kind of higher absorption factors earlier. Are there any specific brands that you feel do that really well?
Wildflower, I think, is a brand that a lot of our patients use. Miriam's Hemp as well. They have a topical at Miriam's. I've gotten great feedback from that, clinically speaking. How about you guys?
We gravitate toward a topical here in New York State from a dispensary called Vireo. They're very affordable and very oily and seem to work pretty well. Although Vireo needs to get back on its CBD game because for a while after recreational, it stopped carrying any form of CBD capsules.
Oh.
So we want to speak to them about that. But that's the topical that I just use. It's just a Vireo brand topical, and there are some brands out in California that I've tried that work very well as well.
IL got a question, an anonymous question, if I can read that, if that's okay. So someone was recently diagnosed with a brain tumor and is recovering from a brain biopsy right now. They've been using a 5-to-1 CBD to THC tincture and edibles in recovery. Any tips for treating pain from something like a brain tumor plus AGDS plus?
Yeah, it's tough because I'd have to look at her past medical history, medication list. I would look at the post-operative report. You know, is there a shunt there, or is it just a simple biopsy? Is there any cerebral bleeding, any brain bleeding history, or edema? So it's a little bit more complicated when it comes to a brain cancer patient.
Is there anything that would be like a version of the product that would be considered safer, or if somebody had more complications in that situation, or does it feel very difficult to kind of identify that?
So I've treated glioblastoma patients, which are brain cancer patients, and some of them are super sensitive to THC. Like they'll take a little bit of THC, but then they'll say, "I feel like my head's on fire, like I have a migraine." And some will take CBD and feel that way. So it really depends on the patient. Sometimes cannabinoids can heighten awareness or sensitivity. So depending on how and where the surgery was and how you've recovered, again, was there any edema, swelling? Did you need a shunt? Is there any, residual complications like visual complications, dizziness, headaches? You might be more sensitive to cannabinoids. So it's difficult to say. But you can certainly try, right? Try a little bit, and then what do you think?
A little more information that this person is providing.
Okay.
Bleeding in the brain, but no shunt in the biopsy. And is also asking what would they do next to get help with that, to get that kind of tailored support in working with cannabis.
So a lot of great cancer centers will have integrative care now. So I would suggest contacting first the oncologist and saying, you know what, I want to think about alternatives to pain medicines besides your typical prescription, besides morphine or opiates or muscle relaxants. So maybe you can talk about like acupuncture or cannabis care, obviously, or CBD. So I would broach the subject that way. Like what other alternative things can I do in addition to what I am already doing with conventional medicine? And oftentimes they do cancer centers are want to compete with each other, and they do have an integrative center. So I would start there. Then if not, then you can always call Leafwell, contact us at leafwell.com. We also have a huge library, a research dashboard. If you want to go to leafwell.com, go under glioblastoma. You can see all the research out there for glioblastoma and cannabinoids. And then my third choice would be to try a 1-to-1. Small dose of a 1-to-1.
We have a related community question, and then I believe there's another question in the chat from Tracy. The community question is a little related to what you just talked about, Dr. Chin. The question is, can you describe how cannabis has helped your patients with EDS and other connective tissue conditions?
Pain and inflammation. Pain and inflammation. That's the biggest thing. Flare-ups is a big thing. I think cannabis medicine is not the end all and be all, but it's one of the toolkits in your toolbox. It's one of the levers that you can pull. So, doing all the things, whether it is, walking, stretching, Alexander technique, walking with using a therapist, making sure that you're less inflamed, could be dietary. But cannabis is definitely works for pain and inflammation.
We will just have a quick add-on to that we do not recommend Alexander technique for lots of folks with connective tissue issues, but it depends on that practitioner. The classical Alexander technique can be very difficult for craniocervical instability, so making sure practitioners have been trained in safety and are thinking about disability accessibility.
Absolutely. Yes, absolutely. With all hyperligament tests, I won't even refer to a regular therapist, even a regular PT. So if they have like Rosen technique, Alexander, it has to say use specialized with hypermobility. I mean, it's amazing because it's almost counterintuitive. The things that health providers are taught that would work, for let's say everyone with ligamentous laxity, it doesn't. So unless you're specifically trained, or even talk to you guys probably have a list of vetted practitioners.
It's not very.
We have a small growing list, and we developed our own safety practice because of this exact issue to have touch therapy that can be safer for people, and we've trained people in that.
Okay.
You're in the Seattle area, if you're in the San Francisco area, if you're in the New York area, if you're in Berlin, those are the people that we have worked with for a long time. And okay, cool. I was also going to add something. No, I'm forgetting. What did we just talk about? We were talking about I don't remember. Never mind. Maybe it'll come back to me.
Maybe let's address this question in the chat first. Someone's asking about our thoughts on cannabis and CBD infused beverages and seltzers. Dr. Chin, why don't you take that one?
Yeah, I think I am supportive of the hemp beverages. I think they're a good alternative to alcohol. Many of my patients will use it in lieu of an edible for sleeping and for relaxation.
Do they kick in the same type of time frame as edibles?
Usually it's a little quicker because as you're drinking it gets absorbed faster. Some of them are infused with nanotechnology, for example. I think Breeze is one of the products that I can think of off the top of my head. So it's a faster acting.
We have another question in the chat, a follow-up question about beeswax and any topical options that might not include beeswax due to any sort of reactions to it.
Good question.
I mean, the other thing one could try is if you're in a state where there is adult use, seeing if there are any herbalists who work with cannabis and make their own topicals and have a conversation about them potentially making one that doesn't have beeswax in it. Because obviously you can't really go to the big companies and you could ask. Um, but yeah, in LA. Okay, perfect. You can definitely find some people there. Or you could also make your own. I know people who play around a lot with making their own and using different strains for their own. They end up uh, finding versions that maybe even work better than what they might find in a store.
True. And also, it's a little messier, but there are topical oils for application that may be less likely to include that ingredient and could be a choice.
Even
Yeah,
like a tincture, which is going to stain stuff, but it is an oil, so it has those same, medium chain triglycerides that we like in topicals. It's just going to be a lot messier. So figuring out, what your application process is going to be, so maybe you don't stain things, or you have a shirt that you wear when you put it on your back or something like that. Um, but yeah, okay.
and we're running a little over, but any last questions from folks?
We do have one last community question. Dr. Chin, would you be able to, and Audrey and Al, feel free to chime in, but could you speak about the psychoactive effects of THC and how that might interact with anxiety, depression, and or PTSD?
I think THC in the right dosages can help. Some folks are super sensitive, in which case you can microdose.
Yeah, and to add, I believe there have been quite a few studies on cannabis for PTSD specifically. And I know that's been incredibly impactful for a lot of veterans and a lot of different folks.
And I've heard of different strains being more helpful or less helpful. I mean, of course, it's going to be not for everyone. But sometimes when I read reviews of products on the website that I purchase from, people will share their experience, and that can be helpful in figuring out, oh, I'm kind of like that person, so maybe that would maybe be more likely my reaction, although of course you could have a totally different reaction. So, um, yeah.
And again, low and slow.
Mhm. Oh, and
Great. Dr. Chen has shared the link for the research dashboard at Leafwell, and we'll also include all these links in our follow-up materials for those, I think, 60 people that will be getting this recording asynchronously. Yeah. Atlas says this is awesome. It is awesome.
everything
Yeah.
Dr. Chen has done is really awesome. You're, I mean, talk about someone who just like did it, just made it happen, which we admire so much. Um,
Thank you so much for having me. I would love actually for you to share a link to providers that are specifically Alexander Technique providers, because that's where a lot of our patients come through.
Oh, really?
Yeah.
Interesting. Okay.
Yeah,
Yeah.
we should talk about that. All the providers that we would recommend have trained in our own technique.
Great. Okay, great. Because some patients do find it helpful,
Yeah.
but it is practitioner dependent.
Exactly.
How
And there are
aggressive.
practitioners, as there are doctors out there claiming to specialize in hypermobility that
Yeah,
Yeah. May not.
should not be making such claims.
that's
Yeah.
right. You're right.
Yeah.
Yes. And we're working to get all those resources out to our community better, and training in our kind of safety and risk minimization technique hyper-accessible proprioceptive therapy, or HAPT for haptic feedback. That will be part of training for many different clinicians we work for in Hyp+Care as
perfect.
well.
Perfect. Great. Thank you.
And craniosacral can sometimes be a safer, although some craniosacral things can still be a little too much on the spinal cord and the pelvis. But if you work with a craniosacral specialist that you want to learn a little bit more, there's a great free resource we could share that a craniosacral therapist in Maine, I don't remember where she is, developed a really great paper that she wrote about what she's noticed is safer and what can be aggravating, particularly to spinal instability and, causing kind of more of a neurological flare, which is kind of, someone put in the chat, does insurance ever cover craniosacral? So the way that this could work is if you can find a PT practice, and you shouldn't actually have to make them do this, but some PT practices out there will do this. They will have a PT aide. So they bill insurance for PT. The PT comes in and talks to the patient when they first come in, but then the person who actually works with the patient is a craniosacral therapist or somebody who does more hands-on, gentler work. And sometimes that can be a way that people get it covered by insurance. So if you're in New York, no, I don't actually, do they do craniosacral?
I'm not sure. Here in New York, and in many places, osteopaths or DOs, who are sometimes also primary care, are also trained in craniosacral and can provide that in appointments.
So I'm a cranial osteopath. My husband's a cranial osteopath. We don't take insurance for that, unfortunately. But yes, it is very expensive. We will give you a super bill so that you could submit to your insurance, but you have to have really good insurance to cover it. There are clinics, like teaching clinics that you can go to, and the students will, you ask for a senior student, which is not a student, they're a physician in training. So that's a way to do it as well. And have them treat you. And usually that's completely complimentary because you're in a teaching situation. But if you are very sensitive to any body work, I do not recommend going that route because you just don't, you get a different practitioner every time. So I would recommend using a PT, the PT route.
There's another question in the chat. How can the caregiver program be utilized to offset pricing to patients? Are you talking about in relation to Hyp+Care or what? Clarify. Is it the care management program or the way that? Or do you mean in relation to NY's patient caregiver program?
For cannabis? Is that for cannabis? Because there's a caregiver program for cannabis. Okay.
For cannabis.
To offset pricing to patients. I'm not sure I understand that, Maya. I know with a caregiver program, you're allowed to pick up medicine on behalf of a patient. But I think the pricing would be the same. But there's home grow. So if you have a green thumb, you as a caregiver, you can grow for other patients and make medicine.
Cool. I did not know that. That's awesome. Learning entourage effect, learning so many things. Yeah, any last questions or thoughts? These are all great questions. Thank you, everyone, for bringing them into the conversation.
Oh, okay, we might wrap up there. And Dr. Chin and us are thinking about other talks. Maybe we could have other things we could do to help out community.
Right.
So stay tuned, and this teach-in series will be going on for a couple more months. And if you'd like to learn about anything we're all doing, we've put the Leafwell links in the chat for Dr. Chen's work, and we'll also be sharing those out in materials, as well as links for the clinic that we're building, Hyp+Care.
Yeah, and thank you so much, Dr. Chin, for just all of the work you've done in your lifetime. It's truly incredible. And to get insurance coverage of cannabis medicine is so cool. So yeah, we're just so happy you're here and sharing your knowledge. So thank you.
More to come. Thank you. Have a great night.
Thanks, everyone.
Thank you, everybody.